Good evening, everyone, and welcome to tonight's clinical conversation. Normally, we have this going live on a Tuesday, but of course, yesterday was Yasmin, my daughter, her 25th birthday, and I decided to take the night off. But here we are to discuss all things IPL and combining IPL. So, IPL on its own is super powerful. I think it's a great device, but when you combine it and in a correct manner, it becomes a completely different treatment. And this is where the most clinics are leaving results on the table. So tonight I'm going to show you how to think differently about IPL and not just as a treatment. But for those of you who don't know me, my name is Nancy Abdu. I'm the CEO from the Australian Dermal and Laser Institute, where I work both with clinics on devices, protocols, and getting real results, not just performing treatments. And one of the biggest shifts I see in high performing clinics is basically that they often, don't rely on a single treatment or a modality. They combine them. And so we know that IPL, like I said, is super powerful, and it's on its own, it's incredibly effective, and I think it can change the skin quite dramatically. We can treat pigmentation, we can treat vascular lesions, we can treat facial redness and diffuse redness and rosacea, general skin tone. Also for collagen induction, it's great to help stimulate collagen for fine lines and wrinkles and stretch marks and scarring. Also for unwanted hair, or what we call hirsutism. So I think on its own, it's amazing, but here's the reality. IPL is targeting specific chromophores. So what we mean by chromophores is targets. And so in some instances, it'll be melanin in the hair, melanin in the skin for, say, sun damage, freckles, and more superficial pigmented lesions, not melasma. Hemoglobin, so vessels, it could be port wine stains, it could be a little cherry angioma, capillaries, and more superficial veins, and water for, like I said, collagen induction. And so it's not actually addressing everything in the skin, however. So if you're only using IPL, you're actually only just solving a part of the problem. So it's specific to those particular targets and chromophores, right? And so why I think, combining modalities is a game changer. And I've been harping on about combining modalities for years and years and years. And in fact, I was having a look at some articles that were written back in, I think it was like 2019, when I was writing some newsletters for facial attraction, and I was talking about combining modalities back then. So we need to remember, however, that yes, combination and combining modalities is powerful, but sequencing and timing really matters, and not everything should be done in one session. So there's a bit of a caveat on this particular session. The other thing is not every skin is ready for combining. So we need to really make sure that before you combine and before we deliver these aggressive treatments, that the skin is primed and prepped properly several weeks beforehand. So we want to make sure that your clients are on a vitamin A, a B, a C. A and C are really important because you want the skin to have the tools to bounce back, to recover, to basically stimulate that collagen and elastin that we're asking it to. It's a great antioxidant. It's going to help fight those free radicals. Vitamin A in particular tricks the skin into thinking it's young again. It helps with cellular turnover, amongst a whole plethora of other things. And vitamin C is also an antioxidant, but it's also going to help with strengthening those capillaries, and it's also a tyrosinase inhibitor. So they're my ABCs are always my foundations to any aesthetic treatment, along with other products to help with the skin hydration and also to support the barrier too. So that's another kettle of fish. We'll talk about that another time. But really, when we're combining modalities, the skin definitely needs to be prepped beforehand, and we also want to make sure that the skin can do what it's supposed to do over the next 30, 60, 90 days. So back to combining modalities. Skin concerns, as you know, are multi-layered. It's not just one specific thing we're trying to target. So for example, if you've got someone who's got pigmentation, the pigmentation just isn't sitting superficially, or in some instances it could be a little bit more epidermal, and it could be epidermal in that cross junction, epidermal dermal junction, right? Or vascular lesions. I know with especially diffuse redness, it could be more superficial, whereas if we've got bigger, more, not heavier, but bigger capillaries that look a lot more redder and more deeper in color, will actually be deeper in the skin, deeply placed in the skin as well. So it's not just at that one depth of penetration, right? And the same thing with collagen. Collagen breakdown is structural, and it can happen, a bit more superficially, or it could be dermally, like, deeper wrinkles, or if we've got someone who's got quite aggressive, like say, ice pick scarring or box scarring. Stretch marks is another one where that breakdown happens a lot more dermally. So that is going to be at a multi-depth as well. And so too is barrier function. Barrier function is a whole separate thing altogether. So expecting one device to fix everything completely is actually unrealistic. And I think that would be unfair to say to a client, or to even think to yourself that, yeah, one treatment, one depth, one wavelength, one device, whatever it might be, can, basically fix absolutely everything. I think that's not, advanced thinking. And I think this is where combining treatments changes those outcomes. And so what am I thinking here? So my first and foremost love, as you know, is IPL, but LED has another place in my heart, 100%. IPL creates that, controlled inflammation. And again, we talk about, being controlled, whilst LED is going to help modulate the inflammation, or accelerate wound healing, support collagen stimulation. And we do that with different wavelengths, of course. So primarily, I'm talking about 633 nanometers, or a red LED. And so, with your IPL, like I said, we're creating the trauma, we're synthesizing, or we're sending those fibroblasts to the area so we can lay down collagen and elastin, whilst my red LED, which I would do leading up to and on the day of, before my IPL treatment, would actually be helping to send, or not send, but create ATP in the mitochondria. And so why not give your skin that energy it needs to do what we're asking it to do? So red LED definitely before. Green LED if you've got someone who's got quite inflamed skin, so someone who's got, for example, rosacea, or if you've got someone who's got quite inflamed acne, or you wouldn't do melasma with IPL, so let's leave that aside. But what you would do is you do your IPL, and then you want to reduce the inflammation as much as possible. The skin is already in that inflamed, that heightened, long-term, low-grade inflammation, that you want a bit of infrared and you want a bit of green LED. If you have green, of course, so it's one of my favorites. See, I have lots of favorites, don't I? But you want to then, deliver your green LED straight after, depending how much heat is in the skin, of course. Because if you're doing a vascular treatment and there's a whole heap of heat in the skin and they should be ice packing, then doing LED straight after is not necessarily the right thing. You might then, in that instance, do it, a bit before, or 24 hours later, or both. So with you're combining those two, another example is your IPL for acne. So you could do your blue LED before for an overall antibacterial treatment, and your IPL is going to be quite specific to those pustular lesions. So we know IPL is going to help with, controlling the healing response or inhibiting the bacteria and the like. So combining those on the same day is fine. Again, making sure that the skin isn't overly heated. The next thing that I love doing, and again, it's not for everyone and for every skin, and definitely you have to be treating IPL first as a baseline and then radio frequency as a baseline on its own. Make sure the skin doesn't, respond in a way we don't want it to. And then we can combine IPL and RF together. So again, IPL is going to improve the texture of the skin. It's going to stimulate that collagen. It's going to help with the tone of the skin, whilst radio frequency is going to help with tightening. So IPL, I get often asked this question, what exactly is IPL doing that's different from radio frequency? One is laying down more collagen and making sure that collagen is actually laid down in an organized manner, whilst radio frequency is actually helping tighten those bundles. So quite different. So again, one's plumping and one's actual firming and tightening. So they work so well hand in hand together. This will be good for that laxity and for that structural aging, where you need to make sure which one actually you're doing first. You need to make sure that we're doing our IPL first, because it is attracted to chromophore, and if you're doing radio frequency first and you've got a lot of erythema, IPL is going to be absorbed by the hemoglobin even further and at a heightened level, and you might run into complications. So you're going to do your IPL first, which is going to be absorbed by specific chromophores in the skin, and then your radio frequency after that. We know radio frequency is colorblind, and so combining those two in that particular order can be safe, as long as we make sure we're test patching the client. You do need to tell your client when you're combining radio frequency and IPL together that there's going to be an extended downtime. So make sure that expectation is actually set before you do the treatments. Otherwise, your clients are going to be really upset and they're going to be quite swollen and inflamed for anywhere from 1 to 3 days, and they're not going to like you. So set the expectation. There's going to be more downtime and a little bit more erythema and edema. And so combining that makes sense in that respect. And then I absolutely love combining IPL and needling. So if we think about what IPL is doing, it's what we call a photothermal response or reaction, right? We're creating a photothermal, so light, heat, interaction with the tissue. Needling, on the other hand, is mechanical. And so you've got two completely different modalities. One is thermal, the other one being mechanical. When we're combining them together, you're inducing completely different physiological changes in the skin. And so with our needling, we're actually needling someone from say 0.5 to 1 or 1.5 mil penetration, and your IPL, you're going to be reaching roughly 2.5 to 3 mil, depending on the wavelength, of course, that you choose and what you're doing. But they're completely two different depths of penetration. So we're actually synthesizing and stimulating collagen at two different depths, and plus we're creating two different reactions or skin interactions within the skin. And what I absolutely love is with needling, we know when we get a bit of petechiae or pinpoint bleeding, we're actually getting the release of platelets. And when we get the release of platelets, you get your growth factors, you get a whole heap of cytokines, your interleukin 10 being upregulated, we're getting a downregulation of melanocyte stimulating hormone. So you're getting two different, like I said, responses in the skin. And if you're performing IPL first, where we get vasodilation, so dilation of the capillaries, then that needling session is going to be much more enhanced. So definitely love combining my IPL, especially when it's in motion IPL, by the way, with my needling. All right, next up is your HIFU and IPL. HIFU, again, two different response, but both are thermal. However, with HIFU, high intensity focused ultrasound, you are only going to be treating with the 4.5. I wouldn't be treating with the 3 or the 1.5. They're too superficial. With the 4.5 cartridge, which is going to help with the SMAS, so the superficial muscular aponeurotic system, which is this particular area here, so nasolabials and jowls. So you'll be delivering your HIFU first, so one pass of your HIFU, and then you can perform your IPL on top. Two different depths of penetration, two completely depths of trauma. And so the HIFU is going to be tightening the SMAS, that muscle, while IPL is going to help with that collagen induction in the dermis. All right, completely different depths once again. What else do I love? I've got here IPL and exfoliation. I think, and it depends if you're a cornea therapist or not, but there's nothing wrong with a gentle exfoliation before IPL for many reasons. So when we're doing a gentle, and I'm not talking an aggressive exfoliation here, so very, very light exfoliation, once again, increases a bit of blood flow, helps those wavelengths penetrate the skin a little bit more effectively and efficiently. It also helps with that, bit of a glow up to begin with, and so your client can feel that not only does their skin look good, but it actually also looks good too. The other one that I've been asked a lot about is also IPL and electrolysis. So how do you combine electrolysis? As you know, electrolysis is for permanent hair reduction or removal. Let us say permanent hair removal. And so how would we combine these? If you've got a client who's got salt and pepper, so let's say they've got a whole heap of black and white hair, what I personally would do is I wouldn't go in with electrolysis to begin with. I would first IPL all the dark hair first, and then you can go ahead and electrolysis the white, once you've done, say, 4 or 5 treatments. Or if there's a whole lot of white hair and definitely it's causing them a bit of an issue and they want to remove the white hair, you could then potentially sequence the treatment. So you're doing IPL this week and the hair will fall out 10 days later, and so now we're left with just white hairs. And then you can do a session of your electrolysis, wait 2 weeks for the skin to heal and recover, especially if you're using the Apolis. That recovery time is super, super short. Of course, we know how little trauma it creates. So 2 weeks after my IPL, we do electrolysis. 2 weeks after electrolysis, you're back to doing your hair reduction with your IPL, and so forth. So you could do them in that way, or depending on how thick the hair and how, I was going to say you could do them the same day. Like you could, but then the shaving gets in the way. So that doesn't quite work when you're trying to combine those on the same day. So alternating is going to be your best route. And of course, let's not forget we've got IPL, not just for the face and the neck and the neck, but we can actually be performing IPL treatments for the body. So if someone has got, poikiloderma, if they've got this red or pigmented, areas of the sides of the neck, and you can see it's symmetrical, that's usually called poikiloderma, and it could be present, a bit further down on the chest as well. You could quite easily treat that, with your IPL too, and you can combine modalities. You could do IPL on their hands for pigmentation and for a bit of collagen induction, and of course, combining that with needling or with a gentle enzyme. So IPL isn't necessarily just for the face. I've treated full arms of freckles, and I've treated, surgical pigmentation with IPL on, on different parts of the body. So definitely it's not just for, like I said, for the face, it's for the body. And like I said earlier, IPL and skincare is going to be really important beforehand. But IPL, we know that the skin is a bit more receptive as well. So when you're doing say a photo rejuvenation, for example, this is really your opportunity to support that barrier repair, to really regulate the pigment pathways that need inhibiting, right? And also to enhance long-term results. Like, definitely I want to incorporate skincare with my treatments. That's really important. So don't just rely on the device on its own. You want to be complementing your treatments with skincare. And so IPL, when you're combining it, becomes far more powerful when it's part of a treatment strategy and not just the treatment itself or a standalone service. So where do clinics go wrong? And I think most clinics, where they go wrong is if they think, oh, it's a one treatment and, one result. Or if they think, yep, it's just the one device and it's just one outcome. Or, basically just thinking inside that box where your manufacturer has said, this is how you turn on your device and this is how you deliver the treatments, but not thinking outside of what else do I have in my clinic where I can safely combine these modalities. So you want to think again, what does the skin need at any and the entry level, of course, and you want to think about, how you're going to layer these treatments, what treatment plan you're going to be offering your client. You want to ask yourself, how do I improve outcomes and not just perform the procedure? And really, the difference is, in treating the skin and managing the skin. And this is exactly why I'm so excited about where IPL is heading, as you may have been hearing me bang on about IPL the last few weeks, because newer technology is allowing us to do all of this better. And the Photon X is designed for for modern clinics and clinics who are a bit more, future thinking and want that versatility or the consistency. They want advanced control and basically better outcomes across multiple indications in a safe and a comfortable manner. And I think that's really what's important here, that we've got safety, comfort, and results. And so that this gets me really excited. Plus, with the Photon X, we have the addition of what we call DermTite. So it's not just IPL. DermTite incorporates a type of IPL, which actually focuses, normally you're going to get this from radiofrequency, but this focuses on firming, on tightening and plumping, similar to radiofrequency, without having to buy an additional device. So now you're combining, your tone correction with pigment and vascular and skin structure. And this is where all these treatments are going. Remember, we can, start to combine skin tightening and, doing your standard IPL with our DermTite. So it's not a single outcome, it's a layered skin improvement. And so next week, we're officially launching the Photon X. So March the 30th from 5:30 to 9:30 p.m. And this is where you'll actually get to see how it really works, how to combine the treatments that I just spoke about, how to build protocols, and what's possible in clinic. And so for anyone who purchases a Photon X on the night, you will receive you've got the choice. I don't know which one you're going to choose because both are amazing. You're going to choose the either the MySet Pro A, which is a fully AI skin analyzer. It's valued at roughly $17,000. Or you can choose an electrolysis device. the Dextro Apolis Senior. And so you have the choice of either, especially with electrolysis booming right now, it's just taken not just Australia by storm, but it's taken the world by storm again. You have the choice of having either one of those. And this is where it changes your clinic completely, because you're delivering better consultations, you'll have better treatment planning, better client trust as well, because seeing is believing. When you're using the skin scanner, you're able to track the results of before and afters. So essentially, you're not just buying a device, you're actually building a smarter clinic. And so there's some food for thought there. And before I finish, if you've been enjoying these lives and the education and the support that Tadley and myself provide to your clinics and your team, as you may have known or you may not know, we've been nominated for the ABIA Wholesaler of the Year for 2026. And so if you believe that education is paramount, and supporting you and raising standards is what we do the best, I would genuinely appreciate your vote, and I'll pop the link in the comments. So if you can get yourself and your team to vote, I would absolutely love that. And if you're serious about improving your results, expanding your treatments, and understanding how to combine modalities properly, then you don't want to miss the Photon X launch. The link is in the comments. Having said that, I actually think we may have sold out, or we may have only the one seat left. So if you have missed out, we will put you on the wait list, and we'll probably run this again. If not, we'll have to find a bigger venue. So even if you can't make it online, no, other way around, even if you can't make it in person, we might actually run it virtually. So make sure, regardless, you purchase your ticket. We'll send you a bag of a whole heap of amazing things, which there's a whole box, not just one mask, but a whole box of our famous cellulose mask. We've got some cocktail peels in there and a whole heap of other stuff. And we will send you out if you can't join us face to face. So tonight has been pretty cool and pretty amazing. I'm hoping to see you next Monday. I'm very excited for that. Let me see if there are any questions. No, hopefully I explained everything really, really well. All right, so I will see you next Monday, face to face if you're coming to the launch. Otherwise, I'll see you next Tuesday night. Have a great week, everyone, and see you then. Bye.